local COVID-19 update. Today I'm happy to be joined by Commissioner Tracy Brown, Lafayette Mayor Tony Wrzorski, West Lafayette Mayor John Dennis, Dr. Esteban Ramirez, the Medical Director of the Protect Purdue Health Center, and Dr. Jim Bean, the Chief Medical Officer at IU Arnett Hospital. We'll begin today with a review of our local data. On the screen, you'll see the 5 data points that we have been monitoring as a community for several months in relation to our COVID-19 situation here locally. The first is, of course, the number of new confirmed COVID-19 cases. The second is the percentage of COVID-19 tests that are positive. This is the percent positivity. The third is the number of COVID-19 hospitalizations, including patients in the intensive care unit and on ventilators. Fourth, the number of emergency department visits for respiratory illnesses. And fifth, the number of deaths due to COVID-19. This slide summarizes our current data. As of today, cumulatively, we have had 2,312 cases of COVID-19 in Tippecanoe County. 812 of those have occurred in the last 28 days. 230 of them have occurred in the last 7 days. 875 of our cases are considered to be active, with 1,424 recovered and 13 deaths. Our number of deaths has remained stable for quite some time now. This next slide shows the number of new cases of COVID-19 in Tippecanoe County, dating all the way back to the beginning of March when the pandemic began. As you can see, our number of new cases recently has significantly increased on a daily basis. The highest number of cases we've had in a single day was on September 3rd when we had 70 cases. Since that time, we've had a day with over 60, several days with over 40. About 2/3 of these new cases here recently are related to Purdue and Purdue students. Another way of looking at the same data is to look at the average number of daily new cases by week. And as you can see, this graph follows the same trajectory, the same curve, an increase here over the last month or so to our highest number, which is where it's at currently, 31.6 new cases on average per day. This slide summarizes our local testing data. We have had cumulatively over 52,000 individuals tested for COVID-19 here in Tippecanoe County. 4.4% of those tests have been positive. In the last 7 days, we've had 3,565 individuals tested, and with 230 positive tests in the last 7 days, that calculates out to a 7-day percent positivity of 6.5%. This matches fairly well with the state of Indiana at 6.6%, 8.6% cumulatively for Indiana. It is slightly higher than recent numbers for the nation as a whole at 4.8%. Our next graph shows our trend in percent positivity dating back through early May. As you can see, the number has gone up and down. We've had, in the last 7 days, a fairly significant increase in our percent positivity. Last week it was at 2.6%. This week it's up to 6.5%. Clearly this number can change from week to week, so we will be watching this number very closely over the next week and beyond. This slide summarizes our current hospitalization data for COVID-19, includes both the IU Arnett Hospital and the Franciscan Hospital. The numbers shown are the peak numbers in the hospital each week. The top line, the red line, is the total number of patients with COVID-19 who are hospitalized. It is currently, or for this week, the peak has been 13. The second line is the number in the intensive care unit. which is currently 1, and the bottom line is the number on ventilators, which is 1. So our hospitalization numbers, thankfully, have remained relatively low when it comes to COVID-19. And our last slide summarizes our emergency department visits for respiratory illnesses here in the county. This number has remained fairly stable for the last 3 or 4 weeks at 161. Of course, we'll be watching this number very closely as we move into the fall and winter when our cold and flu season starts. And that will, of course, be something that we'll have to contend with as we deal with both that and COVID-19 with the coming winter months. So to summarize, we are as a county seeing higher numbers of new cases on a daily basis. About 2/3 of these cases are related to Purdue. With this increase in cases, we have over the last 7 days seen an increase in our percent positivity. As I've stated before, the goal for our percent positivity is to remain at 5.0% or below. We're a little bit over that. Hopefully that number will decrease over the next week or so. We'll be watching that number very closely. So I think looking at all this data together, it's very important that we continue to stay the course, that we continue with all of the good work that everybody in the community has done in terms of social distancing, wearing face coverings, hand washing, avoiding crowds, and avoiding situations where COVID-19 can easily be transmitted. So these are the key steps that all of us need to take to keep our COVID-19 situation here locally under control and to hopefully keep us moving in the right direction so that we can get back to more of our normal lives that I know we're missing so much. Those are all my remarks for today, so I'd be happy to take questions from the media or from our Facebook Live audience.
Hello, this is Anna from WLFI. There's a chance that Governor Holcomb could end the mask mandate statewide this afternoon. What will happen locally, seeing as our numbers are going up? Is there any expectation that Steve Lafayette will join West Lafayette in a mask mandate? Will the Tippecanoe County Health Department issue a mask mandate if the state one ends?
Well, certainly, I hope that the governor does not end the mask mandate because I think it's been a very effective tool, not only locally, but also for us as a state. Just as the CDC stated last week, face coverings remain one of our best tools in the fight against this pandemic, and hopefully the governor will continue with the mask mandate. Likewise, I think that if the mask mandate was to end statewide, seeing as how it's been such a valuable preventive measure, I would certainly be in favor of a county-wide mask mandate. Of course, that would take place in conjunction and in collaboration with our local elected officials, but I would certainly be in favor of that.
And I know for the city of West Lafayette, we've always had a pretty strong system of support for the mask mandate in conjunction with the other simple compliance methods, which is social distancing as well as hand washing. In the early days of the West Lafayette mandate, there was a lot of concern in regards to the punitive measures that would be in effect for lack of compliance. And to date, we have not yet written one ticket. Voluntary compliance has been significant, and we're appreciative of that. But again, like Dr. Adler said, we know what tools we can bring to the fight, and masks are probably one of the best ones.
I would not anticipate that the governor will get rid of the mask mandate today. I think everybody has seen that the mask does have benefits, and I would not anticipate that. You may see some changes today to some of the restrictions, but I don't think that you will see the mask mandate go away today.
Bob Hagan, I'm a retired orthopedic surgeon in Lafayette, and I thank you guys for all that you're doing. Just a question maybe for Dr. Ramirez. I know Purdue is doing random testing, so they're testing about 900 or 1,000 people a day. 2.5% positivity rate, so that's 25 people. Are any of those patients sick, or any of those people having significant symptoms, or are we just false positive paradox where you're checking people with a low incidence of disease and the false positives outnumber the true positives?
So we've been able to gather this information, and we've been able to determine that 48% of our positives are asymptomatic. 49% are mild, and then we now have, I think it's less than, 1.5% are moderate, and then we have less than 1% that required urgent care or ER evaluation and returned back to the isolation space, and less than 1% that actually required hospitalization. So far, the two cases that required hospitalization, they had comorbidity, so they had prior underlying illness. So it wasn't just the illness itself, but there was complicating factors to that. And all those individuals have been discharged since. Sorry.
Question from Dave Banger with Journal and Courier. With 2/3 of the cases coming from campus, are you seeing evidence of spread from Purdue's campus into the community? If so, or if not, either way, how do you attribute to that?
That's an excellent question, and that's one of the things that we're watching for very closely, because that has been reported in other college towns where the college becomes sort of the epicenter for COVID-19 cases in the community, and then that spills over into the rest of the community because, of course, students aren't live their lives also off of campus, and they are going to the same grocery stores, the same restaurants, the same pharmacies, and so on as the rest of the community is. And of course, that can lead to transmission outside of the campus environment. So far, we haven't seen that effect here, but we're watching for it very closely.
Dr. Adler, can I ask a quick question,
Yes.
please? Since it was Dave Bangert on the phone, I saw he wasn't here, and I wasn't sure how to ask this, but since he's on the line, I am curious. I need to get figured out in my mind. You know, Dave does his daily update that he gets the information from the State Department of Health, and it looks like he's got the Purdue cases done up through September 21st. I know this is the 23rd, but he shows a positivity rate for Tippecanoe County in the last 7 days of 2.6. We're saying the last 7 days is 6 point something. And he shows a positivity rate for Purdue also in the 2s, and they've tested over 24,000 people. So I'm trying to figure out why Dave's figures show the last 7 days we're at 2.6, and our last 7 days shows we're in the 6s.
Sure. So I believe the information published in the newspaper is coming from the State Department of Health dashboard. And if you do look at their dashboard, they list for Tippecanoe County a 7-day percent positivity rate of 2.6% for the date range of September 10th through September 16th. And so that does match where ours was. If you look at the graph, September 16th, 2.6%. So during the last 7 days from September 17th through today, that number has gone up to 6.5%. So the state dashboard lags behind a week. So I would expect next week, when they show the percent positivity for the period of time, including this actual week, their number will match ours.
Okay, so if Dave's there, so what we're reading in the paper then, as part of positivity, is not actually day-to-day, it's actually a week in the rears.
Yes, yes, September 10th through September 16th.
Okay.
We had 41 new cases today. Is there any, are these more related to Purdue? Is there a cluster somewhere in the county, or just any explanation for our cases today, I guess?
I haven't looked yet to see what today's Purdue number is, but perhaps Dr. Ramirez could give us that.
So we have 4 current congregate houses that are under large-scale quarantine. 2 are actually going to be completing today. One of those has an increasing amount of cases, and they had their first case a couple days back. So we were anticipating that because we tested the whole house, we would see some positives, which sort of supports the fact that we're quarantining appropriately, right? So we are seeing those increases as anticipated from that one positive case.
Hi, I think Dave's question touched on this a little bit, but have you seen more cases in apartments specifically near Purdue's campus in the last few weeks?
Is that to me?
Anyone?
Go ahead. I've heard of a couple cases in a couple different apartment complexes that we're keeping an eye on, and we're working closely actually with the county on those particular apartment complexes.
Can you speak to how many cases there are in Fuse and if there's a cluster there?
I don't have the numbers in front of me.
There was a cluster at Fuse in July and early August. That has resolved, though.
Is the county health department considering any sort of similar things that are happening down in Monroe County with IU, how their health department has issued directives towards the Greek and cooperative living houses on campuses? Is there anything that the health department is doing to help with Purdue with these cases that are increasing in the houses?
So we've been working closely with the Protect Purdue Health Center and on what sorts of processes and protocols are in place within the Greek houses to help reduce transmission of COVID-19 and hopefully help to lessen the chances of situations where you're needing to quarantine a large portion of the house or the entire house.
Dave Bangert would like everybody to know he goes with what the state reports. And a question from him, do you think Purdue's surveillance testing strategy is working to protect those off campus?
Well, I think the surveillance testing is very helpful because it helps sort of fill in those gaps and gives us more of a snapshot of perhaps cases that may not be detected otherwise. And for that reason, that's Purdue's part of our community. And so knowing that information gives us a better feel for how much COVID-19 activity is actually occurring in our community.
So with that in mind, shouldn't you have two separate graphs there? One for the people at Purdue that are 30 to 40,000 people, most of which are being randomly tested, and then another for the people in Tippecanoe County that we want to know whether our rate is truly going up or not. If the rate in Tippecanoe County is 4.4% and the rate of positive tests at Purdue are 2.5%, coming up with this number 6.5 just seems additive. Has that graph there considered the denominator is a lot larger? There's more people when you add the students in? Or do we just simply take the number of cases at Purdue and add it to our normal Tippecanoe County population? Just a statistics question for you.
Yeah. From the county standpoint, we look at the total number of cases, so those involving Purdue and non-Purdue, because we're looking at the community as a whole, the county as a whole. Purdue is part of our community. Purdue is not separate. It's not insulated from the rest of the community. And certainly Purdue students, faculty, and staff interact with the rest of the community. And so we don't differentiate it in that way.
But how can we follow if it's going up with members of the community if we're just adding in the number of positive tests without adding in the total number of people? We have 30,000 more people that started randomly testing about September 9th when that scale kind of started going up. I would think if you really want to protect the Purdue people and test and protect the county people, you'd want to have both graphs up there. If you want to combine them, fine, but as a member of this community, I'd like to know whether our rate is going up with the Purdue students being here. My sense of what you're showing is it has not. But people are looking at that number and thinking it is.
Well, certainly We don't want to give the impression, though, that Purdue is in some way not a part of our community, that it doesn't affect the rest of the community. We think it does.
So is there some way to get both those data sets out there? I mean, if you give me the numbers, we can divide it out and come up with a graph right there, but people look at it and say, oh, we've got 40, 50, 60 cases in our county now. First of all, you have 40, 50, or 60 positive tests, not cases. When you have a positive mammogram, that does not mean you have breast cancer. There's other testing that comes in between there. So we should be reporting the county data, the Purdue data, and then combine them if you want to, because it's different subsets of people. It's people randomly being tested at Purdue, whereas in the county, it's people that think they might have symptoms. You see what I'm saying?
Mm-hmm. Yeah, we can look into that, separating those.
Question from Dave Banger. Will there be county health department restrictions or guidelines issued for Halloween and or trick-or-treating?
You know, certainly, you know, we'll be happy to issue some guidelines. I don't anticipate we'll be issuing any kind of restrictions about Halloween. Our guidelines and advice for Halloween would be very similar to what the CDC has advised. The CDC released some guidance about Halloween just in the last couple of days. And certainly the guidance is very consistent with the same sort of approach that we've taken towards other community events. And those would be things such as certainly staying at home when you're sick, not participating in in-person activities like passing out candy if you're sick, using face coverings, hand washing frequently, thinking about ways to make the trick-or-treating process contactless. One suggestion from the CDC is a one-way trick-or-treating where you simply line up the candy or goodies on the porch or on the driveway, and kids can pick them up rather than getting them directly from a member of that household. We certainly recommend no homemade items, using only prepackaged or pre-wrapped items only, and certainly, you know, one family at a time at a house there for trick-or-treating. And looking at things like not leaving a big bowl of candy out on the porch where you're having kids reaching into it over and over again, but distributing things, you know, individually, one at a time. So there's certainly some ideas and guidance for Halloween that we think will help keep everybody safe.
Where are we at on the restaurant mandate? Are there any changes that will be happening in the near future with lessening the restrictions on restaurants and bars?
Mm-hmm. You know, as I've said before, I think we're going to, of course, follow our local data and let the data guide us on that. We are considering modification of hours of operation, so that is being considered and you know, may possibly be coming.
Thank you. Just for the record, I want to know that I very much support that, and I'm hoping here in the near future we can get to at least the 1 o'clock a.m. for some of our local bars that serve the people that work 3 to 11, getting off at Subaru, Wabash National, and our factories that depend on that window in there very much for their livelihood of those businesses. So I'm very much supporting, hoping we can get to that 1 o'clock a.m. here shortly.
Hi, Ryan Chen, Purdue Exponent. This is kind of a question for Dr. Ramirez and Dr. Adler. So if a Purdue student is from Hamilton County and lives there like when they're not living at Purdue, but they spend most of the year at Purdue because it's school, right? So if they test positive in Tippecanoe County, where does this case get reported? Does it get reported to Hamilton County or Tippecanoe County? Because I know ISDH has some guidelines regarding communicable diseases and like how they're reported.
Yeah, so in the case of Purdue students, the goal is to report those as Tippecanoe County students because those students are living here for the majority of the year as students. And so that's what we've aimed for, is to have those students addresses entered as their local addresses here and not assigned to their home county or their home state.
I agree, 100%.
Question from Facebook Live. Should elementary schools still allow Purdue students to come in and do student teaching during the pandemic with Purdue's numbers?
That's a good question. I'd have to think about that and get back with you on that.
This one's for Dr. Ramirez. I had a viewer ask me this week, where are the Purdue isolation beds? Because I know it's quite a few amount, and I can't imagine you have them all in just like one building. So I'm just wondering where these isolation beds are and like where these kids go when they get tested positive.
I'm not going to identify exactly where the address is, but it's on campus, and we do have 940 beds available. In fact, we're only using 40 of our 940 beds at this time, which is really good. We want to have as much capacity as possible and hope we never have to use any of that.
Question from Facebook Live. Do you think the virus weakening the more it is spread, and what are the chances of it mutating once flu season starts?
You know, I haven't seen any data about the virus weakening, and I haven't seen much information about known mutations of the virus. Dr. Bean or Dr. Ramirez, have you seen any information about either of those?
I have not.
No? Okay.
So this would be a question for Dr. Bean. The numbers that were reported that there's 13 people admitted to the local hospitals for COVID. Are these patients that have COVID, or are they people with, quote, suspected COVID because they've undergone a test, they have a hip fracture, and they can't go back to the nursing home until that test is negative? Are these true patients with COVID, or are they people in limbo waiting for a test or procedure?
So we keep track, good question. We keep track of both patients who have a positive test and fall into that they have COVID, and patients who are under investigation. I believe the numbers that we're looking at on this slide are in that first category. So this morning at IU Health Arnett, I can say we had 4 patients who had disease, and there were, I think, an equal number of patients who were under investigation. And thankfully, over the last number of weeks, that relatively low number has been kind of a stable presence. We've not seen an uptick as we've looked at the graphs, and this should be apparent to all. We've not seen an uptick at the hospitals of COVID, though both hospitals have been quite busy with general medical illnesses and surgical needs.
Question from Emily Seiberg from WBAA. What guidance is the health department considering for other upcoming holidays such as Thanksgiving and Christmas, given that they center on large gatherings of people indoors?
So that's an excellent question. We haven't really gotten to those holidays yet, but certainly anytime you're having a gathering of a large number of individuals, of course you want to be cautious. You want to, as much as possible, exclude individuals who are sick. You want to, of course, encourage hand washing, social distancing as much as possible, face coverings if possible. So a lot of the same precautions that we've been talking about when it comes to other holidays, such as we've had Labor Day and 4th of July.
Question from Dave Banger. Will the county health department do its own dashboard for COVID cases in schools? If so, when should we expect to see that?
So currently, we're not planning on a school-specific dashboard. Some of our area schools have their own dashboards. The State Department of Health is in the process of creating a school dashboard. I haven't seen all the details of what that dashboard will entail, but we are, of course, watching our school data closely, and depending on what the state dashboard looks like, if we need to supplement that with some additional information, we certainly can.
So Purdue has made it clear that they will not be sharing any more information or details regarding the Greek or co-op houses. Will the county health department at any point if the numbers get high enough, or if the numbers get high enough, is there a point where the community will know which houses are impacted, the numbers, the positivity rates? Is there any point where it becomes, a community safety aspect?
And that's really you hit the nail on the head there. It becomes an issue for the public if it gets to a point where it starts to impact the public as a whole. If it's impacting certainly just the members of a particular Greek house, then we work with the Protect Purdue Health Center in that house to contain the problem and prevent it from happening again. But to the extent that it becomes a public issue, really depends on whether it's a situation where it could somehow impact the general public.
This may be a question way beyond any of our expertise, but I'll ask it anyways. Are any of the labs around here capable of doing quantitative PCR testing? Where I'm coming from on that is the PCR test is reported as a simple binary test, yes or no. But actually the lab has the data to know how many copies it takes of that material they have till they find virus. So some of the thinking is the threshold, the cycle threshold has been set so high that people test positive for it that don't have the problem. The states of New York, New Jersey, and Massachusetts went back and tested a random group of people that had tested, or looked at the data from a random group of people that had tested positive, and changing that threshold from 40 to 35, 90% of the people would not have tested positive. So do any of the hospitals know the quantitative number they're using, or is it just simply the lab does it and we really don't know?
Yeah, I don't know the threshold at which the IU Health lab has set to identify a positive case.
Same for Purdue. I'm not sure what ADDL uses.
Okay. That'll lead into a later question, but.
Question from Dave Banger for the mayors. Have the cities reported additional Purdue pledge cases to the Dean of Students?
Not that I'm aware of.
No.
Commissioner Brown, did you have something you wanted to
Yeah,
add?
just a couple of comments real quick. I know we've got other people in line, so thank you. Dr. Hagan, I think he is spot on with the idea behind breaking out the Purdue numbers, and I think we could still do them combined, but I like the idea of breaking those out, because if those Purdue numbers go up and our community numbers do not go up, then we know, one, we have an effective program at Protect Purdue, and we can quantify that, and we can react differently based on that. So I would think it's important to, maybe if you want to report them together, I think it would be interesting, at least for us, to see that data on a frequent basis. And I want to echo the sentiment from Mayor Wrzworski and Mayor Dennis. Our local restaurants and affiliated businesses are suffering right now. And I know that the hospitals have, all of this is driven by numbers, and I know that the hospitals, Purdue University, even county government, we operate under this notion that when numbers get to a certain level, we respond, and that's what gave us our current restrictions that we would have. I would just, I think it's important that if we are going to have numbers that we use to shut things down or restrict things, that we come up with a system or a set of numbers that allow us to move in the other direction as well, primarily because and the mayors are the ones that are getting the calls from local businesses, and we can't predict. Nobody knows when COVID is going to be over. The only thing that we have control over right now is how we're going to react to it, and it seems to me like we had some positive moves there, and I absolutely appreciate Dr. Adler's his position as to where we are right now, but I'd like to be able to kind of look out into the future and just ask that question: where do we have to be before we go to a 1 a.m. or before we go to a lifting of the occupancy restrictions? And again, this is driven by the importance. We are all committed to protecting public health, but that means protecting public health and the public's financial health as well. You don't have one without having the other. So that is just, that's my, just a simple request. I think the team's done a wonderful job. That's maybe just one more thing that we can consider moving forward.
Thank you.
I also think it's important, I hope Dave Bangert is listening to this, that we understand the concept of base rate fallacy. I think I've emailed several of you. It's a statistical thing. It's kind of hard to understand at first. But the New York Times bestseller, The Undoing Project, written by Michael Lewis, who wrote Moneyball, details the lives of Danny Kahneman and Amos Tversky. They won the Nobel Prize for their work, and one of the fundamentals of their work was base rate fallacy. If you take people who show up to an emergency room that are short of breath, that have a cough, have a fever, there's a high probability those people have COVID. So the test that you do does not have to be 100% accurate. If you take people with a low rate of a disease, like the Purdue students, and randomly test them, the Purdue students' incidence of having COVID may be 2%. Unless you have a test that's 99% specific or better, you're going to find more false positives than true positives. And you can look that up on Wikipedia. There's a great example that this falls into. So I think you're comparing apples and oranges. You're comparing the people that come to the healthcare providers with symptoms of COVID with randomly tested people at Purdue and trying to mix those two together. So look up base rate fallacy, spend a little time to understand it, and I think you'll find that we are falling into the same trap that Harvard medical students fell into when asked the identical question. Okay?
Okay, thank you.
Question from Dave Mayer. Following up on Commissioner Brown's question, when would those hours in the restaurant changes happen and at what metric?
Well, you know, certainly the idea with these restaurant restrictions is to be proactive rather than reactive and to stay one step ahead of this pandemic. I mean, this pandemic has given us unprecedented challenges, and we look at what's happened in other university communities, what's happened around the country and around the world with transmission of COVID in restaurants and bars. We're simply trying to stay one step ahead of that. And, you know, we certainly want to see our percent positivity be in a favorable position. We would like to see the numbers of new cases that are occurring daily trending downward rather than upward. Those would be two main metrics that we would be looking at.
If I could just comment on that just briefly, and this may be one time where Dr. Adler and I don't exactly agree. I think it's going to be important, though, that we look at where those cases are coming from. If 2/3 of them or 80% of them are at Purdue University, and we're going to say if Purdue keeps going up and they're randomly testing thousands and thousands of people, and that somehow impacts small neighborhood bars that are trying to survive by people getting off work that work 3 to 11 and need just an extra hour so they can get off work, have their dinner. Not everybody gets to work 9 to 5. Not everybody works 7 to 3. Other people have lifestyles that, you know, their lifestyles matter too. And I don't think it's going to, in my mind, it's not fair to me to tie all of those cases to whether we can open up for an hour. You know, most of our restaurants downtown and those, they're closed by 10:30 or 11 o'clock. We're mostly talking neighborhood bars, different locations throughout Lafayette. So for me, I mean, I think we really need to look at the data, and it can't just be the number of new cases, you know, per day, because that's not relevant to what we're talking about here in its entirety. So I hope we keep an open mind about that, because I personally don't believe adding an hour will make any kind of difference in the actual case situation, but it can make a lot of difference in the people's keeping their business alive and their mental health and their physical health from the stress that they're going through, which is also a very real medical condition also.
Hi, I didn't introduce myself last time, so I'm Joe Duhonick, Purdue exponent. Dr. Ramirez, do you think there's a moral or ethical dilemma in putting all of our sick students in the same buildings where our family housing is also located?
No, because we have things where we have our isolation space is very protected. We actually have an on-site support team. So we are able to actually knock on every door, make sure folks are doing well. And if there's any aberrancy in behavior, we can go ahead and take care of it quickly because we have folks on site.
Thank you.
One last question and comment, and this is really an ask for a proposal. If we've all followed sports, we see that many of the different professional leagues have been able to have sports successfully. What they have learned is testing an athlete once, they may fall into the trap of having a false positive. They may fall into the false positive paradox, like I explained before, base rate fallacy. So the NBA started it where if they had one athlete test positive, no symptoms, they said, something's wrong here. So they tested them the second day with either one or two tests. If they were positive the second day, then they said, well, that person probably has a problem. If both of them were negative, then they said, well, the first test was inaccurate, or the amount of virus that person had is going down so that they're no longer infective, no longer a danger to themselves or anyone else. So NBA started that, NFL went with it, Major League Baseball went with it. The NFL recently reported 41,000 tests done in their players with one true positive and 7 true positives in staff support personnel by using that kind of a system. So my question is this: if I find somebody to provide the money to pay for that second and third test, and I'm willing to put my money where my mouth is and be the grantor of that particular study, would the county or Purdue be willing to ask the people that test positive randomly or that test positive just because they had to get tested because of school and have them tested a second and third time? If that was paid for, would the county go along with letting those people out of quarantine? You know, from my standpoint, when I was in college, if somebody told me I was tested randomly and happened to test positive, but I was not sick and could not go to chemistry lab or physics lab or biology lab, I'd have lost a whole year of study. You can't miss 2 weeks in those important disciplines and come up with a good grade. So are we willing to be proactive and do our own study here in Lafayette with Purdue's guidance or with the county's guidance to figure out if these are really positive or these false positives? So if I can put that together and get the approval of the state, will we implement it here in Tippecanoe County?
Well, I think it would need the approval of the state because we've had that situation come up where we've had an individual test positive and then test negative on a subsequent test. And so when we've asked the epidemiologist, the State Department of Health, which test do we follow? What do we do? They've advised us to follow the first test, the positive test. In other words, the quarantine, the outcome, the isolation was not influenced by the second test. So we'd want to clear that. We'd want to talk to the state about that.
Well, that kind of policy worked real well for Jimmy Johnson, the NASCAR driver, Matt Stafford, the football player, Governor DeWine from Ohio. Both of them have an initially positive test, scratched their head and said, but I'm not sick, I haven't been exposed. Got a second and third test that were negative. They were back to doing the things they should do. So I think we need to be a little proactive here. It'd be nice if an antigen test was available that was $1 or $5. You could test all these people as much as you want to. I realize there's a cost to it. But I think to change economic policy, to change public health based on tests that were released under the FDA's emergency use authorization, have no data that shows their accuracy, is being irresponsible as us as citizens in our country.
I think that'd be an issue to take up with the State Department of Health.
Okay, and then is there someone that I can contact that will return a phone call or an email? I've called 3 people there Some have been suggested. None of them want to get back to you. And I'm not going to name any names, but is there someone, Jeremy, you can help me get to that will listen? It's working in the NBA, it's working in the NFL. If it's good enough for an Indiana Pacer, it's good enough for Purdue Boilermaker.
I can get you the name of the people that we contacted the State Department of Health with our questions.
And if they say yes, then you as a county will say yes. It would just be, if Purdue has 20 people test positive, it'd be 20 more tests. Could Purdue do saliva tests on 20 more people in a day?
Well, we're pretty optimized as much as possible, but we'd have to see what the numbers would look like.
Okay.
Absolutely.
Hi, Dr. Ramirez, a quick follow-up on my question, if that's okay. The on-site specialists that you mentioned, you said, are they checking in on students or families or both? And also, are the two actually separated by a building?
So the location where the isolation takes place, they're actually, they knock on the door. We have paramedic team that makes sure that they're doing well. They have a face-to-face contact. They also assess to see how they're doing and how they're feeling. If there's a need for further evaluation, they're prepared to do so. Or they can just call me if they have medical questions, and then we help them through that. So we have folks on site that will do that. There's no families of the students that live there, so on the isolation place.
Right, okay. So the family housing is separated?
So the isolation space where these folks are, there's no families in that space, just students.
Right, gotcha, thank you.
Question from Emily Seiberg from WBAA. How would it ultimately help to create a default assumption right now that students have no impact on the community? Isn't it too early in the school year to make that assumption?
I'm sorry, can you repeat the question? I got lost in the first part there.
How would it ultimately help to create a default assumption right now that students have no impact on the community? Isn't it too early in the school year to make that assumption?
Yeah, and I have not suggested that students do not have an impact on the community. I think students are a part of our community and certainly can affect the community. They interact with the community, they interface with the community, they use the same stores and other off-campus establishments that we all do. So certainly they're part of our community and would impact the community.
I have some questions for Dr. Ramirez. So what was the company, so does Purdue PPHC contract with a company to help facilitate testing?
I'm sorry, could you repeat that?
Does PPHC contract with the company to help facilitate testing?
We use the ADDL, which is part of the vet medicine school. So they run veterinarian samples, but they went ahead and received approval to run COVID samples as well. So that's what they are doing now, but they still, take care of a hospital and all the tests that go on there as well. So they're a fully functioning, very efficient lab, and that we've been blessed to have on our site and really been helpful for us.
What's the average number of tests being able to process per day?
We are on average 700 to 800 per day testing people. And that's just us. So again, that lab does even what they do at the hospital too. But just from the COVID standpoint, we're doing 700 to 800 samples a day.
So it sounds like all the testing, the facilitation of testing, it's all done within Purdue. Is that correct?
Yes, and that's what gives us the ability to not feel like we're taxing the county or the state and other resources, because we can utilize our lab and our resources there on site.
How many student workers do you guys employ student workers with this, or?
For the lab, you mean?
Yeah.
I don't know how the lab runs their. Yeah, I don't know how to answer that because to my knowledge, they are lab personnel that are hired by their hospitals.
Thanks.
Okay, I think that concludes all of our questions for today. Thank you very much for attending, and we'll see you next